Hey everyone, good evening and welcome again to the next version of Lockdown Live. Thursday evening this week, but thanks for joining in. It's great to see so many of you tuning in as well. So whether you're at the Shrewsbury Club or Homer Park or you're either one of our Imagine members, you're all part of the Mosaic family. It's great to welcome you along this evening. We've got a topic and some guests that I think are really relevant and so important to the situation that we find ourselves in. And in fact, one of our guests was so good that he's reappearing again for the second time. So Dr. Col, welcome back to Lockdown Live, and thanks very much for joining us.
Thanks for having me back. I think it's more of a case of it's a second attempt to get it right. I really appreciate the opportunity, Dave.
Well, I'm not so sure about that. Not from the feedback that we got. And joining Dr. Col is Mel Spooner, who's been in the industry nearly as long as I have been. And Mel, it's great to have you along here. Mel also is part of the program that Col has put together to help instructors be well versed and well trained on how to help people that have had COVID. So Mel, welcome along as well, and thanks so much for putting this whole course together. I know so many of our instructors have learned so much from what you and Col have put together.
Thanks, Dave. Thanks for such a kind and warm welcome. And hello, everyone at home.
Excellent. So you probably know the rules if you've listened to this before or watched this before, but you can put comments, whether you're watching us on Facebook or Instagram or YouTube. You can put comments and we'll see them and we'll try and take those. This evening session is dedicated to a topic that's actually been right in the newspapers a lot recently, and it's something that's well talked about in the media, and it's long COVID and how exercise can play a part in helping you to recover from long COVID. So I think it's going to be really relevant. I know we've already had some people emailing in, making sure that they could log in and join in. And certainly if you want to add your comments as we go through and have our conversations around long COVID this evening, then we'll do our best to try and deal with those questions as well. So let's get stuck in, Colin. I think what might be really useful if we start off with a little bit of a recap. You helped us understand when we were here last time a little bit more about COVID in that last session, and we kind of identified the fact that COVID in itself is not the real problem. It's kind of the effect that COVID has on the body that causes the real damage. So maybe just to start off, do you want to just sort of explain a little bit about that again? Because I think that really helps people's understanding about what COVID is all about.
Yeah, no problem. I think I fully understand how you phrase that, but I just want to just clarify something. So
sure,
COVID itself as a virus is a novel virus, and it's decidedly unique in how it's behaving and functioning, and because I don't want to make people think that we're kind of, what's the word I'm looking for, belittling it. COVID itself is an issue. However, the mortalities that are associated, so the deaths that are associated to COVID, are because of the knock-on, the domino effect of the presence of COVID, the virus. So this is where people are having, cardiac events, pneumonia, neurological issues and breakdown. This is like the domino effect. And for the vast majority of people, it's those underlying causes, those comorbidities that they were dealing with prior to having COVID-19 that are exacerbated, are amplified by the presence of COVID and the damage that it brings about. For the vast majority of people, and currently the global survival rate, and it has undulated a little bit, but currently the global survival rate is 99.3%. For the vast majority of people, what we're seeing is that COVID acts as a virus that in the worst instance, the symptoms can be quite severe themselves, although there are those who are asymptomatic. But what we're seeing across the board now in growing numbers are people in two kind of groups. One group is that they have their COVID-19 and then it just takes them a long time, up to 5-6 weeks to really shake it off. and they're left with levels of fatigue, increased resting heart rate, increased breathing rate, perception of effort. They might have some joint pain, and that can grumble away. So just can't shake it off.
Sure.
Where that turns into long COVID is where you have a number of those symptoms at any one time. Typically, we see that they're getting worse, not staying the same or getting better. And because it's now defined as a syndrome, it's kind of the alignment of a number of those symptoms and the severity of them that take you down the syndrome route of COVID-19. So COVID-19 as a virus, and I'm more comfortable using this term because we actually spoke to an immunologist from Manchester University on Monday, and he used the term. So I'm back to feeling comfortable about it now. It causes damage. I was so reluctant to say damage before, but that's what it is. It causes damage. Yeah. It causes damage to the alveoli. It can cause neurological damage. It can attack the hemoglobin. It can affect some of the vital organs. So that's what the virus does, and it's the consequence of that damage that's really leading to the problems that people are dealing with.
So, you mentioned and sort of started to allude a little bit about long COVID, and it's a phrase that we're hearing more and more, and we're seeing people, in the news that are kind of fallen victims of it. But how would you sort of describe long COVID, and what do we understand? What do you, in your role as a Doctor of Physiology and a scientist, what do you understand about kind of long COVID so far? Because obviously this stuff's only been with us a year.
That's right. Yeah, it's brand new, and I have the kind of benefit and the privilege of just being able to access the research directly and talk directly to and collaborate with some research groups across the UK and across the world. So that's my kind of privileged seat on it, and understanding of the physiology and the pathophysiology of what's going on. So what it is really is that the virus, going back to the virus itself, the virus is really, really clever in as much that it gets in, sits upon the cell. Just to go through this, I know we did this last time, but just to refresh everyone's memory, sits on the cell, sends a code into the cell to replicate itself. Once it's achieved a critical mass, it then sends the code for destruction, and the immune response is triggered, comes in, creates a cytokine storm, and just to start taking out tissue left, right, and center. It's, all guns are blazing. And then for the vast majority of people, the second wave of the immune response has now been able to start to target these adverse cells more specifically and deal with them. So the T cell production, the B cell production is then able to identify the ones that it needs to clear off and not just attack everything, and starts to make good on it. What we're seeing in the terms of long COVID is that damage has come at a cost. So the extent of the damage has left a long trail of symptoms that you can't just simply just get over. Rest alone is proven not to be enough. So that can be the damage that's sustained at the lung, at the alveoli. It can be this neurological interference. We're seeing increased inflammatory markers because the body still feels like it's in viral conditions. That in itself is being associated with the pain symptoms that people are getting around their joints, tendons, ligaments, this kind of more of a kind of systemic type of aching. We're seeing brain fog, difficulty with concentration and cognitive tasks, which then again has some relationship to this neurological interference. Early reports talked about COVID-19 attacking the hemoglobin. And then there was some dispute on that, but we are still seeing that across samples around the world. It doesn't happen in every instance, but it does happen in some. So whenever there's been a compromise to the lung itself, and then the oxygen carrying potential of the blood, well, then it's not hard to understand why we're seeing increased resting heart rate and increased breathing rate and increased perception of effort. So when a person has experienced COVID-19, when the virus has been present, and then they get over that acute response, immune system recognizing it, kicking it out, what we're left with then is the extent of the damage in its wake, what's been affected by its presence. And then I guess, really, I hate using the word guess, but my estimation of where the research is leading us is saying that the severity of that damage is influencing and impacting on the extent of their long COVID. So that those two, it's kind of picking up on the trauma that's taken place whilst the virus was active.
Cool. So long COVID can be different things for different people, can't it? Effectively, the way that it manifests itself in the body can be different for different people. And how long is that going to kind of last? Is that something we still don't know? How long the effects are going to be with somebody?
Yeah, I mean, it's been now since we last spoke. I think I mentioned that they were looking at classifying it as a syndrome, and that's been confirmed now. So as a syndrome, similar to things like fibromyalgia, ME, we know that now that this could be, for some people, a condition that they need to adjust to. We certainly know firsthand of people who knew that they were long COVID, but have had that diagnosed now, who are 12 months down the road. Fortunately for us, and we've never really discussed this, Mel, but fortunately for us, anyone we know in that category is actually showing improvement. So with the coaches that they've been working with, they've actually started to show improvement, quality of life, activities of daily life, reduction of symptoms. So there's positivity in it. But what I'd say is that I would expect, and I might regret saying this, but I would expect that the vast majority of people, it's going to be a second phase they need to work through, and they're going to get through it. But I would also say, given the fact that it is a syndrome and the nature and the way in which the mechanics of it, some people could be dealing with it for an indefinite period of time.
Sure. So Emma's been on. Emma's commented. I think that this is a common question that I've kind of heard. Be interested to get your take on it. So she's had COVID. It looks like for almost a year now. Still feeling a bit fatigued. Smell and taste haven't returned to normal. She's still got the antibodies, having had an antibody test. And she's worried about having the immunization and whether she actually needs it or not. What would your take be on that, Col?
Wow, here we go. Huge question now, and I've been in two debates today with other researchers and medics on the old vaccine debate. Sometimes I wonder what I think anymore. Personally speaking, I would encourage people to have the vaccine. And if you had COVID at 12 months ago, and even though you've had an antibody test, which is great because they're happening less and less. And you've still got an antibody profile, I would encourage you to have the vaccine, because we in most instances the antibody profile is 5 to 6 months, so it might well be, and I don't know, so please recognize I'm admitting I don't know here. You might have had a secondary infection, so you might have had COVID twice, which is not uncommon, by the way. The fact that you've still got an antibody profile now at 12-month mark, and you've struggled in between, it could be that you've actually had a second exposure. I don't know, but that would make more sense to me. I would encourage you to have the vaccine. The vaccine, looking at this purely from a research point of view, looking at the data, whether it's the Pfizer or the AstraZeneca, they are safe. They are, they have a proven efficacy in the context of COVID-19. The early data coming through in the context of long COVID, the early data coming through is showing that it has a positive impact on long COVID symptoms, which makes sense given how this thing pathologically is active. So I would encourage people, and I know I'm going to now 50% of the audience are going to hate me. I would encourage people to have the vaccine. I would, yeah.
I think that's great advice. I think it's good to get your understanding on it, and so thanks for your input, Mel. I'm going to turn to you now. I mean, you've helped put this program together with Col, and obviously the rebuild program. There's 3 programs basically that our instructors are going through, and across the Mosaic group we've got 35-40 instructors going through this program. And there's 3. There's rebuild, there's rebound, and there's the one that for the moment has jumped out of my head. Fortitude. Yes, of course. There you go. So you can tell I'm still on my rebuild. I haven't got as far as anywhere further. So tell us a bit about how they've been put together, and tell us a bit about what what skills they're providing for the instructors, so that members that we've got watching, they're going to be coming back into our clubs, will understand what it is that the guys that they're meeting in our gyms have actually been taught.
Got it. So for the rebuild course, I think Col touched on this a bit before. We kind of knew quite early on in 2020 that with the rate at which COVID was reaching our communities, and there was the early signs of long COVID, that there were going to be people that we worked out with, that came into the gym, that were under our care, that, working with PTs, that would potentially experience COVID and would have questions. And we wanted to make sure that we were able to provide guidance and answers and understand exactly what it is that everyone had been going through. So for the COVID course, like the broad structure of it is anybody that goes through it will go through like a whole fundamental section where they'll delve into more detail on a lot of the stuff that Col just talked through. So what actually is COVID-19? What damage does it inflict? What does that mean for the human body? What that spectrum of symptoms looks like? How long COVID can evolve from a physiological perspective, pathological perspective, etc. And then from there, how to then start to have that sort of a conversation when you are working with members and clients and you guys listening, to start to ask certain questions and have a particular open, comfortable, safe conversation, which can help you, if you've been experiencing COVID-19 and long COVID, to unpack the journey you've been through, the symptoms that you've had. And you don't have to, go through that in a particular order with a coach or an instructor that you have this conversation with. You can just throw it all out there, get it all out. Probably for a lot of people, for the first time, it's the opportunity to kind of share that information. And then we're providing the tools behind the scenes to help the coach to unpack what all of that means. And then with that information, the coach can then go, okay, so what we can do is run a couple of dead simple tests, nothing taxing, obviously, deliberately, nothing overcomplicated or intrusive. And we'll do like a couple of simple tests that are set at a certain level dependent on what that conversation produced. And then the guys will go through a series of tests which will ascertain probably what kind of impact to us, without opening ourselves up, what kind of impact COVID has had on us, which then helps the coach to go, okay, so we understand that, today's start point versus where it might have been before, this is the kind of difference that we can see just by running some simple tests. So with that, armed with that information, the coach can then determine the best sort of rate of return to normal daily life, normal activity, work, being busy at home, and of course, intensity of fitness and exercise. And then the guys will put together like a structured program, probably in the first instance, I guess, just to manage expectations. It can just be activity. And like I'm just reading the comments, and anybody listening who's had long COVID will know that in some instances, walking to the end of the garden can be a struggle. But that's okay. We know that. We, in terms of the expectations of the coach, we get that, and we can work from any kind of start point in that way. And then it's just about building up from there. And any of the, as Col mentioned before, any of the guys that are already working with people who've been through this scenario have all been walked through their long COVID era. And now after that, then we focus on, okay, so we're out of the long COVID zone, but you felt that you've been out of your usual everything for 12 months. So then we go, okay, so let's kind of work you returning back to this level of exercise and activity that you love the most. And then from there, that's where we kind of go, okay, so now we're through that phase in your life. Let's focus on where you want to be next, like what kind of the performance goals then. So there's a real timeline out and a real predetermined road out of it, and then just a real kind of positive journey beyond. Lots of analogies.
Sure.
But did that make sense?
Yeah, no, it is, absolutely. And I think that's, one of the things that I've been doing the course as well, as you know, and I think one of the things I've got out of it is that, there's a tendency for those of us who've been in exercise and who like exercise and like using gyms that, we want to get back into our routine and we want to kind of push ourselves. That's naturally what we tend to do in a gym environment. But that's almost the opposite of what we need to do if we're suffering with long COVID, isn't it, Col? I mean, it really is something that we've got to treat with respect, and we've got to just build ourselves back really slowly. Can you just talk a bit about that for a moment for those that are listening?
Yeah, absolutely. You've nailed it on already. A big part of my research area for 15, 20 years has been fatigue, whether that's related to, physical activity, sports development, human performance, or disease. Yeah, and the one thing I want to say to everyone, no matter how mentally tough you are, mentally resilient, physically tough, no matter what your exercise background is, you can't work against fatigue. You have to work with it. You have to recognize it's a fundamental limiting step. It's not acute tiredness. It's not pronounced tiredness. It's fatigue. Fatigue itself is a condition. So, yeah, check your ego. And a lot of people, that's not fair. It's not ego. For most people, they have an expectancy of themselves based on their prior experience. And they get frustrated with themselves because they go, I know I'm fitter than this and I'm stronger and I know I can train hard and I just need to rough this out and do some tough sessions and get back to where I need to be. That's not it. The strength you need now is the strength of discipline. Like, discipline your mind and take the steady road. Okay, you've got to be patient with this. You've got to take the slow road, and we've got to build from the ground up. The good news is that if we do that, we can establish a new level of fitness, exercise tolerance, and then we can kick on and be as strong, as fit and fast as we want to be. But we've got to reset the foundation. We've got to restore the tissue, rehabilitate the tissue, and then start to progress. So we've got to do it that way. And the feedback we've had, the insight that we've had, and I'm dealing with this from the elite end as well, is those who've tried their hardest to work against it and push through and persevere are the ones who delay their recovery the most. It just goes on and on, boom and bust, push, push, push. Then the wheels come off and back at it, and they get trapped in this cycle, and it becomes ever more demoralizing and frustrating. So recognize that from the start. And when we're coaching people, tell them that's what will happen. So let's not do that. I keep saying to everyone, slow is the new fast. Just go nice and steady, build it from the ground up, and only progress based off what you achieve and accomplish, not because you think you should be able to do something.
Sure. So I think I want to deal, and there's a couple of comments coming in that I think this is really relevant to as well. So a key part of the program and a key part of what we're going to be doing through the Rebuild program is based around some really, really simple basic tests or measurements so that we can actually start to monitor progress. So I think it'd be useful, Col, if you just talk a bit about what some of those tests are and actually why recovery from this illness is best done, I suppose, to be honest, with the support of an exercise professional, because Emma's on again, and I know Rosie as well, who's been in touch with us directly, have really been struggling to get back from, Rosie's been really struggling to get back to be able to, she wants to be able to play tennis, but still suffering from some of the symptoms. And Emma's saying that, she's shattered after shifts and just hasn't got the energy for an extra exercise. And that's a classic case where actually by doing some of these tests, that's going to really help to kind of understand the progress that they're making. So yeah, can you just elaborate on that a bit for us?
Well, the testing and there's no saying, if you're not testing, you're guessing. And I always think that's one of the biggest differences between what we do in the elite environment versus what we do with the general public. Our assessment and our monitoring within elite sports environment is everything. And every decision we make on behalf of the athlete is based off that. And really, where there's best practice across the fitness industry, we do that as well. And most PT courses, level 2, 3, 4, talk about it. But all too often, I think it gets a bit left behind. So in the context of this, we've brought in the monitoring and assessment, one, so we can establish a baseline. And we've used permeation to the Rockport test. Reason being is I've really adapted that from my clinical background and what's currently used across the world now with regards to clinical and acute rehabilitation, whether it's cardiovascular, COPD, neuromuscular, whatever it is. The Rockport is a really good test. And the reason being is it allows anybody to make some attempt at the Rockport, and we can use that as our baseline. So it really is, it lends itself perfectly to looking at exercise tolerance and aerobic capacity from the most debilitated all the way through to someone who can really kick on and give a maximal effort. So it's brilliant for that, and it's simple. Low level of equipment required. In fact, to a certain extent, no equipment, and we can administer it anywhere. Functional accuracy. So a functional test.
So sorry, Cole, sorry to interrupt. So just to go back a stage, because there'll be a lot of people perhaps listen to this that kind of that aren't from the industry. They just actually work out in their members. So just I mean, do need to go into the detail of the precise mechanics, but just explain briefly what the Rockport test actually involves. So I think it's so simple and it's so easy. We're going to be using it in our clubs, I know. So just explain a bit how the Rockport test works.
So the Rockport test is really simple. So it's either walking, jogging, walk and jog, running, however you can go about doing it. And you can either do the half mile or the mile, you can do a kilometer version, or you can just do the 6 minute or the 12 minute. So you can choose which version you want to use. And essentially what we ask the individual to do is we take their pre-resting exercise heart rate. So we see what they're like at rest. And then we ask them to undertake the task of either walking or running for 6 minutes or 12 minutes or a mile or a half mile at a moderate pace. So it has to be something they can control. They can maintain a conversation. They're in control of that effort and that intensity throughout. What we measure is time over distance or distance within time. And we measure their heart rate and we ask them to give us some feedback with regards to how they feel. So we get that perception of effort, we get their heart rate response, we get how far they've covered in what time. So that gives us an indication of overall speed. The beauty of it is if you can only manage 10 seconds, we've made a start. We've got 10 seconds, 2 yards in your heart rate. If you can run all out and give your best PB performance ever for a mile, brilliant. We'll measure that. So it lends itself to multiple use and interpretation, and it's really sensitive to change over time. That's why it gets used clinically. 1, for its convenience, and 2, for its accuracy and repeatability. So a person who's coming back to the gym, the instruction for them based on what they tell the coach and how they feel could be, we're going to attempt a 6 minute walking test. And we want you to be in control, comfortable, able to communicate with us all the way through. And we're just going to track your heart rate, how that responds, and how far we get in the 6 minutes. And there is no fail, because if you, like I said, if you can only do 30 seconds, we've got some data. And so this is really important because we know for the vast majority of people, the virus COVID-19 will affect the cardiorespiratory, so the lung tissue, the respiratory mechanism. So we need to reestablish that aerobic tolerance. We want to make sure, for a person to be able to just function normally, do their activities of day, they need a level of aerobic tolerance. So it's only right that we prioritize that within our test. And that could be where we start our exercise based on how the person performs in the test to really good, structured physical activity to begin with, that we're going to build up, increase our frequency, increase our duration over time until we can start to bring about more of an exercise stress. So greater intensity, greater period of time, until we get through and we start to get beyond 10-minute periods of sustained activity above 55, 60% heart rate, because then we know they're coping with oxygen deficit and they're in a full exercise range. And we'll just take our time getting through that, looking for improvement along the way. So that's why the Rockport test fits for everyone, because everyone needs to work on their aerobic capacity, their exercise tolerance. It's important. It's really important. That's what we do. We're humans. We breathe, and being good at breathing is a key to survival. So it's right that we measure it and that we develop it, and that's a part of our developing the person from a performance and most importantly from a health point of view. So it's a primary part. Then obviously we do look at function and we look at some strength, but it's all relative. This isn't maximal strength and it's not complex function. It's really simple things done well. So we can look at the extent of how someone is able to articulate physically, look at movement accuracy, and then look at how we can maintain posture when we bring strength factors into it. And then again, we've got these really clear baselines on where we should commence our exercise progression from. We're not guessing anything. It's based off what the person can do. The assessment allows them to be successful because it caters for any level, and it's sensitive to change over time.
Yeah, and it's excellent, and certainly from my own experience of working within gyms, etc. The idea of just testing and measuring improvement has sort of just been reshaped slightly because of dealing with people that are suffering from COVID. But it's still at the heart of what we need to be able to do, and it's a way of helping to give confidence and encouragement that it might not feel as though actually you're able to do anywhere near as much as you were, but actually you're doing a little bit more than what you were 2 or 3 weeks ago, which is what the long-term recovery from this is all about. So it's excellent. I think, Brian's asking me how many members of one of our clubs at the Shrewsbury Club have had COVID-19, and the honest answer is I don't know. But what I do know is that we have had a lot of emails in from members from all our different clubs asking us about, COVID and how they can recover from that, and some people that are really struggling with it. And Mel, I think from working with you over the past few months, obviously you've been going at this now for a while, and there'll be a tendency to think, well, this sounds fine in theory, but does it actually work? So I know you've got some great stories to tell of some of the successes you've had with people, so I wonder if you could just share one or two now, which I'm sure will encourage those listening.
And speaking of some of the comments in the group and stuff, I guess to give people hope, but hope that's founded in reality as well. When we were talking about Dave before, who one of our coaches, Dave's been working with a chap called Rob, who found out about the rebuild program through a webinar that we'd done for endurance athletes. So super fit guy, kind of like late 50s, early 60s, recreational cyclist, loves a triathlon, that kind of thing. Got long COVID to a debilitating state, like quite a complex mix of about 10 different symptoms. Probably had been enduring long COVID for about a year when he started working with Dave. He actually emailed us today, and he is now 30 minutes off a full day at work without any issues. So he can he's kind of just 30 minutes towards the end of the day, starts to feel it, but other than that, kind of his working routine is back into gear, and he's been training consistently at a specific level set by Dave, obviously, twice a week for the last 6 weeks, and he started to get back out on the bike again. So he kind of prefaced that feedback by saying, I was nervous before because I didn't know if this was going to be me for the longer term. I didn't know if it was reversible. I didn't really understand the impacts that a coach and working with someone could have, but truly thankful and had just wonderful things to say about Dave. Similarly, we've got Jan, who's she's almost like our long COVID icon, really. Jan got COVID. He's a legend. So
which is an unusual title to have.
I'm not sure
long COVID icon. So yeah.
in the best success story kind of way. So she got COVID in March 2020. And again, so Jan was 60, as probably the fittest she'd been in 20 years because she was turning 60 and wanted to be like kicking ass. She was doing CrossFit 5 times a week, picked up COVID, and literally, again, her long COVID situation continued to spiral. She almost had a stroke at one point. Debilitating fatigue, couldn't walk the length of the garden, couldn't take the stairs, couldn't focus on work, trying to keep her shit together and look after a family, and she's like primary carer for her parents. There was a few instances where there was some concerns around the health of her heart, constant pins and needles, headaches, the whole 9 yards really in terms of spectrum of symptoms. She started working with our first ever rebuild graduate actually at the end of November. So by that point, what's that, like kind of sort of 8-9 months of horrible situation. Within probably 8 to 10 weeks, she started to report that she felt that she was walking out of her long COVID situation. Probably a month ago, long COVID is kind of now well in her rearview mirror, and she's now focusing on that kind of return phase. We don't like using that word return, but that decondition phase that we were talking about before. So she's working through that. And so far as functioning in terms of as a mother, as a wife, work, general activity, all nailed down. So now she's just focusing on getting back to her fitness levels. They're like a couple of long COVID examples. But then also we've got another Dave, lovely Dave. He's actually a member of Col's gym. And he got COVID in December, but knew that there was a coach at Col's gym who knew how to handle the situation. And he was thinking, wow, I know that he was aware, because of the awareness and conversations going on at Col's gym, that he knew if he made a few missteps, it could lead to more difficult times. So he connected with one of the coaches at Col's gym almost instantly out of that very acute phase. And because they then were able to manage the rate of return back across daily life, fitness, etc., Dave managed to avoid long COVID completely, and has starting to feel what he would call normal, but still cautious and sensible, probably about 6 weeks sort of out of that. Right. So it kind of, I guess, the purpose of sharing those stories really is to say that, you know, our coaches have worked with some of the most extreme scenarios that, handled with the right pace and carefully, are all creating, you know, tales of triumph on the other side. And then equally, like, this is why Col and I love doing sessions like this with you and the guys, because if we let people know that, you know, these are some of the missteps and this is the help that you can get at any one of the gyms that you're a member of here already, it means that, you know, if the worst happens and you do contract COVID, you know that, you know, you guys are just next door to kind of talk about it with and get back to health as quickly as you can. So hopefully that provides a little bit of hope and comfort.
Yeah, and I think a lot of the stories that have been shared through the training are just so encouraging. Col, I want to move on and touch on to one other subject, that because I know, again, from reading the comments that are coming in and just from talking to some of the people, that, you know, one of the ways that long COVID manifests itself is that people suffer from like extreme tiredness or fatigue. And you know, I know in one of the sessions that I was on the training, you explained the difference between tiredness and fatigue, and I think that's really helpful for people that are going through it. So do you want to just sort of explain that? What would you describe as the difference between being extremely tired and fatigue? Because actually there is a difference.
There's a huge difference, and the easy way to summarize this is that fatigue is a complex condition, and that can be related to changes that we're seeing at a hormonal level. It can be due to changes that we're seeing at a muscle architectural level. More often than not, what we're seeing is a suppression of metabolic factors that is just not something that simply sleeping or resting is going to facilitate somebody overcoming. And I guess one of the best ways to differentiate fatigue from tiredness is to say all the things that you would do to address tiredness. So eat something, hydrate, rest, sleep, to overcome it won't really have any impact on fatigue. That's right. Not going to respond. That's not what's going to make fatigue respond. What's going to make fatigue respond is the very gradual changing of those physiological and hormonal responses due to the appropriately pitched level of physical activity and exercise stimulus. Nutrition plays a huge part, of course it does. And obviously we need to encourage good sleep behavior and rest behavior amongst everybody. But the way that we're going to overcome that fatigue is to change those physiological processes for better ones. And that takes time. It's all about stimulus versus response and adaptation. And it takes time. So you have to recognize that the raw material that you want to work with and influence is compromised from the start. It's not just that they're tired, not that they lack motivation. There's a compromise here as to how this is working. So what we're going to do is go really gradually to re-establish how it's working and start at low level adaptation. So that's the key bit to recognize. And so for people who are dealing with it, this is really important to put across, because you touched on this before. It's really hard, isn't it, when you've mustered enough of yourself to go and do the things you need to do, look after the children, do the school run, take care of things around the house, go to work, whatever it is you need to do, and then go, and now I have to go and do some exercise because that's what's going to help with this. It's really hard. And that's one of the reasons why you need to be in the hands of somebody who can guide and support you and be your motivation when your motivation's not there. Because right at that point, when you think, I don't want to do that, I feel absolutely spent, that can't be the right thing to do, that's where the art of getting this right exists. And that's where the coach is able to say, listen, let's just do enough. Let's tailor make this session to get just enough of a response so that we gain a little bit more ground. That's where the PT, the coach, comes into their own. That's where their skill set, their expertise has a value beyond any other, because they can objectively look at that individual and just guide them and support them and encourage them and do the important part of just getting them to do enough to make this much of a change on a daily basis. If we make this much of a change on a daily basis, by the end of the week, we've done this much. By the end of the month, we're over here, 2 months, and it starts to really snowball. We start to overcome fatigue. The hardest part is overcoming inertia. When we get past that first part, it then really does start to kick into gear later on. But we've got to change those processes, and exercise on those terms is sending a different signal for those hormonal markers. We are starting to upregulate the heart rate and metabolism and metabolic processes. We're engaging the system with regards to oxygen in a different way through upregulation. We're starting to bring about architectural changes to the muscle itself and the skeletal tissue. And all of this combined, the holistic output of this, is how we overcome fatigue, true fatigue. So it's really important to recognize that. And anyone who's had fatigue, and I'm sure there's people who are listening now, it's hard to articulate, but anyone who's had it, the difference between fatigue and tiredness. They feel entirely different. It's ever present, it's persistent. Despite how much sleep you've had, you feel the same level of fatigue. And that's because it is different. So please do, coaches, PTs, individuals who are dealing with, give yourself a break. Recognize that you are overcoming something that's quite debilitating and a condition in itself. So treat it respectfully and treat it with patience. Go steady and overcome it gradually.
And that's great advice. And the other thing that you touched on when we spoke last time, which I thought was really helpful, is we talked a bit about diet and the kind of food that we eat, etc. And you gave some really good advice last time generally about diet. And I wonder, as we're talking about kind of long COVID tonight, whether there's anything that you'd advise for long COVID sufferers in terms of their diet.
I mean, we're just coming, dietary recommendations change on the season. And we're now coming to the late March, early April. So we're starting to get that essential UVB light through again. So we're starting to stimulate our own vitamin D production within the skin, which is great. But you're probably not going to get enough of it for another month. So despite that, I would encourage people to look at their daily vitamin D intake, not because it's going to prevent you getting COVID, not because it's a treatment for COVID, but because it is implicated in the normal functioning of our immune system, which in itself is miraculous. So do look at your daily vitamin intake, and probably supplement for the next 4 to 5 weeks. Whenever it comes down to looking at the calorie equation, really be honest and start to think of how much you actually do overall, and not just the exercise component of it, and make sure that we're not in calorie, deficit, nor are we taking too much. So let's make sure that we've got an appropriate level of energy intake. We know by looking at the data that sedentary time has increased across the UK since lockdown, on average 14 hours per week. So whilst people have been doing a bit more physical activity, the negative side of that is that they've been sedentary for longer for more each day as well. So do consider that, with regards to your energy requirements. And again, if you're fatigued, it's not a lack of energy availability. Okay, it's not tiredness. So actually, if you're fatigued, the vitamin and the nutrient content of your diet is every bit as important as the energy content. So be looking at those things. I encourage everyone towards their fibrous carbs, their leafy greens, making sure we're getting good sources of our dark leafy greens, our spinach, our broccoli, our kale, our bok choy. make sure we're getting, we're starting our diet from that type of prep. Good quality sources of protein. Try and keep your red meats down to a minimum. Favor fish, white chicken. And if we're going to go to fish, then we're looking at our polyunsaturated fatty acids. So we want really good fatty fish, our salmon, mackerel, tuna, sardine, making sure that they feature. If you're not getting sufficient amount of that, 3 or 4 meals of that per week, then you want to look at supplementing with probably a type of omega-3 supplementation to make sure that you're getting sufficient amounts of that. That's really important when it comes to recovery, because all the research shows us that when there is a sufficient amount of omega-3 in the diet, we have a prolonged anabolic phase in the wake of exercise. We reduce the amount of muscle breakdown due to exercise, and we reduce the amount of kind of DOMS, soreness related to it. So those omegas have a huge part to play in our recovery. So look at those as key staples to start with, really. And as always, reduce your reliance on ultra-processed foods. Make sure you're preparing and cooking more from ingredients than you are from products. If it comes out of a packet or a tin or a box, it's a product. If you have to chop it, prep it and wash it, it's an ingredient. So try and move more of your diet that way. I promise you that changes your health outcomes and your health statistics dramatically. So these are key things that I would encourage people to look at. And then the classic one, which I'm going to finish on, which every GP around the world will applaud me for saying, is every day try and take a teaspoon of extra virgin olive oil. Get that polyphenol, rich, that phytonutrient rich dose every single day with regards to its anti-inflammatory properties. Key way to help you to manage any kind of chronic condition or illness.
It's brilliant advice. And I think one of the interesting things, so I live in Suffolk and close to a market town, and one of the interesting trends that, speaking to the guys in the town, is that there's a real tendency that people have gone back to the old way of life because we've been in lockdown. That no longer are we doing massive shops, that we're actually going to the marketplace and buying stuff fresh, because it's a chance to get out, actually, and it's a chance to go and buy something on a more regular basis. So the idea of, rather than stocking up huge amounts of processed food and putting them in the fridge to grab out when we're tired after work, actually people have got a bit more time, those have been furloughed, and the opportunity to go and buy fresh food. So it's been interesting to see there have been a number of people, I think, that one of the trends of lockdown has been for people to prepare their own food, which in itself, as you've just identified, means that you're probably going to eat more healthily than what you would be doing otherwise if you're just relying on something that comes out of a box or a packet or whatever. So it's great advice.
Absolutely. And even just to add to that, I totally agree with that. Do that more. But even the big supermarket chains have said that they've had to restructure because more and more people have been going and buying fresh produce than ever before. So let's keep that up. Let's do more of that. But better still, if you've got a local butcher, a local greengrocer, local farm shop, go and spend your money with them. Please support your local industry. It's probably been grown more locally to you. There's a huge benefit for us all to shop that way. 100%. I couldn't encourage it enough.
Well, we're nearly coming towards the end of our time, and I need to go and prepare my my salmon and kale for my dinner, obviously for tonight. But before I go and do that, Mel, I think there'll be people on here that are obviously members of our clubs, and clearly we've got people pretty much in every single club that has now gone through the training with you guys, and will be able to provide some of the support and advice that we've been talking about tonight. And I know Rosie's asked, and the club that you're at, Rosie, absolutely. You just need to go to the club when we reopen on the 12th of April and ask to make an appointment with one of the gym instructors, and we'll happily work on a program for you. But there will be people undoubtedly who are joining in on this, which is great, who aren't necessarily members of one of our clubs and maybe are in a different position. So just explain how they can find help from someone that's been through the training, because you've kind of set up a sort of a directory of instructors or whatever. So explain for those who are interested and aren't able to come into one of our clubs, how they can go about getting this advice that we've talked about tonight.
Got it. Thanks, Dave. And I love that community spirit. That's awesome. So a good protocol would be to, if you kind of want to pick up on some of the things that we've talked about today a little, if you go to our YouTube channel, which is called Cause Daily, there's lots of material on there that you could dip in and out of.
And just sorry, Mel, just spell that, because people might wonder, well, how you spell cause. So okay. Let's get that right.
So CAWS Daily.
Yep.
Be mindful on the YouTube channel that, of course, a lot of the content will be directed towards coaches. But if you have a little look in the comments, we always talk about what's discussed in each video, and sometimes there's a timestamp. So if there's a particular theme we've talked about, whether that's long COVID or returning and limited pace and all that kind of stuff, you can take a look in the comments for that. On our website, trainwithcause.com, there's a little green banner at the top of there, and if you click that banner, it will take you through to a page which has got a form on it. And if you are looking for some advice and some support, and you're not near to one of the Mosaic clubs or one of the guys, you can fill in your details in that form. Tell us a little bit about your story. Tell us where you're based. That form will then come through to us. We'll take a look and find someone closest to you who can help. And if it is that we don't have someone in your postcode just yet, obviously we're working on trying to make that service as available as many postcodes as possible. But we do have coaches that are providing support remotely as well. So if anybody's struggling, you can get help that way.
And one of the things I think is great, and it would be one of, certainly if I was listening, one of the questions that I'd be wanting to ask is that, you know, there's so much more information that's coming out about COVID because it is such a new illness and disease. And so, you know, theories are being challenged, ideas are being changed about what the best thing is to do. But your course is kind of ongoing. So although there's an assessment that people have to pass, is that you're constantly updating the information that those of us that are on the course and have registered with you can kind of access. So our knowledge is being constantly fed, and we're being updated according to what's coming out from the latest research, and that's presumably something you're going to continue to do, right?
Yeah, 100%. Yeah. Sorry, Col, what were you going to say then?
I was going to say 100%. We're actually filming brand new content over the next few days to go in, and the course evolves as our understanding evolves. And that we felt that was an important part right from the start, because it's novel, because it was something new to the world. It would be impossible to go, there's the course, do that, and you're done. You know, it has to evolve, it has to be updated, and that's what we've kind of pledged to do.
Yeah, we talk a lot, don't we, all kind of about this duty of care, and that's our duty of care to you and your guys.
Cool. Well, look, I want to finish on a positive note. One of the things that is that, you know, some of what we talk about and some of the stuff that we learn, it's tough listening, and you know, some people are finding life hard right now, but I think, you know, the way that the two of you speak, there's kind of you're realistic and you're honest, but there is also a sense of hope. And so I'd kind of like to just finish, Col, with you sort of just offering some kind of encouragement for those people that are out there and feel like they're on a long journey and the road ahead is still incredibly long. So yeah, what kind of encouragement would you be able to offer?
I'm just going to be really sincere, and I'll tell you. And this is a combination of my kind of personal philosophy and my professional understanding, is that every step you make towards improvement is going to take you further down the road than you believe. Now is the time for people to own their own health. And by the slightest movement you make on a daily basis, that one tiny, like, more positive nutritional change you make will always work to the smallest meaningful change. You're going to see a roadway ahead of you, no matter how long, that's going to be based on constant improvement, that you will start to feel and be better all the while. The other thing I'm going to say, which is really important, for the vast majority of people, this is just something to overcome. I promise you, for the vast majority of people, as difficult as this feels right now, we will all get through this together. It's just something to overcome. And we'll do that best by sticking together, relying on the expertise that's within our community, within our whole health and fitness industry that is exceptional within the United Kingdom, and in fact in most parts of the world. But I feel like we're just superb at it. We've got it so well placed within the United Kingdom. We're based within the heart of the community. We have experts on hand. We have, you know, a resource that is invaluable. So we're ready to get past this, and let's get past it together. So people should reach out, get in touch, and start to just work to that one tiny positive change each day. And before you know, you've got an entire track record of success.
Right, it's a brilliant way to finish. And I think, you know, your point about community just sums up why, you know, I'm passionate and confident that actually gyms and health clubs will continue to thrive, because actually that's what they offer. It's a sense of community. It's a sense of people being able to get together and chat and yeah, socialize whilst they're working out. And so I think that's a big part of what we offer, along with obviously the advice. So it's a great note to end. Dr. Col, as ever, you've been wise and wonderful to listen to. So thank you so much for your time this evening, for giving us an hour to just share your thoughts. It's really valuable. And Mel, big up to you as well, because you know you're the passion and drive behind this whole cause kind of course and training and everything else, and it has been transformational for our guys in terms of understanding how they can provide help. So we are truly grateful for you, and love the fact that you're prepared to also take an hour out of your evening. I know how hard you work, because I know some of the times at night that you email me, which is which shows that you're working long hours. So yeah, we appreciate you giving up another one of those hours to talk to us tonight, and your input's been great. So that's it for tonight. Thanks so much for joining us, everybody. We're back next week for our last Lockdown Live, when we're going to be talking about working from home and how to do that in the most healthy and best way. But thanks again for joining us. Hope you've enjoyed it, and we'll look forward to seeing you. It's Wednesday night next week, so Wednesday night at 7 o'clock for the last Lockdown Live. Good night, everybody.
Take care.